Myself, Dr. Laxmi Mali. I am from the Department of Homeopathic Materia Medica, Bharati Vidyapeeth, deemed to be University, Homeopathic Medical College, Pune. I have brought, or rather designed, this lecture series in a very simple language and presentation which will help the students in understanding the remedies in our materia medica or in our homeopathic materia medica very easily, and also help the students in its practical implementation. Our today's topic is Allium Cepa. Before we start with Allium Cepa, let's go through the objectives. The objectives through these presentations are: first, to know the prover of the drug. Next, to know the common name of the drug. To know the source and the preparation of the drug. To understand the sphere of action and pathogenesis of the drug. By the word pathogenesis, you understand the disease-like symptoms which are produced or which are manifested at the time of drug proving. By understanding the sphere of action, we understand the action of the drug on the different systems of our body. Next, we also should understand or should know the causation or the ailments from the modalities of the remedy should be understood. By modalities, we understand the factors which will either increase the complaints of the patient or the factors which decrease the complaints of the patient. Next, we will also learn over here the general characteristics and particulars of the remedy. And lastly, the relationship of the drug. The relationship of the drug plays a very important part, especially in the practical implementation of the drug or at the time of follow-up. So now let's proceed our drug Allium. As the inflammation in the nasal mucous membrane proceeds, which leads to nasal coryza, it later leads to inflammation of the mucous membrane in the throat, larynx and the bronchi. This leads to profuse secretion of mucus from the mucous membrane of the larynx, throat and bronchi, which results into incessant hacking, tickling cough. It leads to catarrhal laryngitis with hoarseness, and with this the patient will complain of rough and raw feeling in the throat. There is also a sensation as of a hook being dragged upwards in the larynx. Allium cepa predominantly affects the left side. Thermally, Allium cepa is chilly. The causative factors of Allium cepa, or the factors which are responsible for the complaints in Allium cepa, are getting wet. They are the bad effects of getting wet, getting fit wet, exposure to damp cold winds and weather. Also, the GIT complaints come up from eating spoiled fish or even from salads and cucumbers, or rather overeating of salads and cucumbers. It is also indicated in the neuralgic complaints which arise from injuries or post-operative or after surgical operations. Allium cepa is indicated in phlegmatic patients. When you say phlegmatic, it is understood that these patients have a tendency for increased mucus secretion. So, friends, Allium cepa is principally a remedy for cold. Allium cepa is principally a remedy for the colds. The head complaints of Allium cepa. The characteristic head complaints of Allium cepa are the catarrhal dull frontal headache which comes up with coryza or which is seen along with coryza. There is a peculiarity of this headache of Allium cepa. Here we find that the headache ceases during menses and returns when the flow disappears. By this, we understand that whenever the menstrual flow starts, the headache will stop. And whenever the menstrual flow stops, the headache appears. The modalities of the headache are that the headache is better in open air and is aggravated on returning to warm room. Let's see the neuralgia of Allium cepa. It is the traumatic neuritis that is seen in Allium cepa, which is seen after amputations or injuries to nerves. There is also this facial neuralgia that is present, which is left sided, and the pains in neuralgia are thread like pains. By neuralgia, friends, you understand that there is inflammation of the nerves. And these neuralgic pains, there is a sensation like a long thread which has been passed over on the face, head, and neck. The pains in neuralgic affection of the face, it tends to move towards the ears from deep within the head. The causative factor of Allium cepa neuralgic complaints are, as said earlier, it is the amputations or the injuries to nerves which is responsible, but also from exposure to damp cold winds, getting fit wet, and the modalities, or it is aggravated, the complaints of Allium cepa neuralgic complaints are aggravated on returning to warm room and in evening. They are definitely these pains, as it's a generalized modality of Allium cepa, that the ameliorating factor in Allium cepa seen earlier or as discussed earlier is better in open air. Though Allium cepa is not frequently indicated for toothache, yet we have some peculiar symptoms of the toothache complaints in Allium cepa, and they are better. The toothache of Allium cepa is better by picking or sucking the teeth. Sucking the teeth is like you blow in the air inside in the between the teeth which is paining. When they blow in the air, they feel good or they feel better. Also, it is better in cold air or by cold washing. The toothache of Allium cepas are primarily neuralgic toothaches. Now let's talk about the nasal symptoms of Allium cepa, which is the primary symptom or the predominantly marked important symptom in Allium cepa. The nasal complaints will start on getting wet or on exposure to cold damp air. When this person gets exposed to cold damp air, or when they get wet or when they wet their feet, they will initially start having nasal discharge with sneezing from the left side. Later, the right nostril or the right nasal is also affected. The nasal discharge is acrid and watery. By acrid, you understand that this acrid discharge or the discharge is so acrid, or the nature of the discharge being acrid will result into redness and excoriation of the nostrils and upper lip. The nasal affection is also accompanied with bland discharge from the eyes or watering of the eyes. This is a very important concomitant of the nasal symptoms of Allium cepa. Whenever the Allium cepa gets affected on exposure to cold damp air or getting wet, they will start sneezing, will have nasal discharge which starts from the left side, later it goes to the right side. This discharge is acrid and watery, which results into redness and excoriation of the nostrils and upper lip, and along with the nasal discharge, this patient or this person will come up with discharge from the eyes which is bland in nature, by this word bland, it means that it is a non irritating discharge from the eyes. The nasal complaints are accompanied with frontal headache which is very severe and the patient can't bear the pains. This is seen when the nasal complaints are very acute. The running nose is followed by stuffing of the nose. There is stuffing of the nose which is due to the inflammation of the mucous membrane in the nasal cavity. This inflammation further spreads into the ear, throat and larynx. And later we will also find that because of the inflammation of the ears, there will be discharge of pus coming out from the ears. In the nasal cavity, you will also find the nasal polypus is also seen commonly in your Allium cepa. As the inflammation in the nasal mucous membrane proceeds, which leads to nasal coryza, it later leads to inflammation of the mucous membrane in the throat, larynx and the bronchi. This leads to profuse secretion of mucus from the mucous membrane of the larynx, throat and bronchi, which results into incessant hacking, tickling cough. It leads to catarrhal laryngitis with hoarseness, and with this the patient will complain of rough and raw filling in the throat. There is also a sensation as of a hook being dragged upwards in the larynx. This inflammation of the mucous membrane in the larynx, the throat, which leads to increased mucus secretion, will lead to cough, and this cough compels the patient to grasp the larynx, because with each cough the patient feels, or the person who needs Allium cepa feels as if the larynx will tear apart. There is a sensation as if the larynx will tear apart with each cough. This cough of Allium cepa is better in open air, is aggravated in evening, lying down, at night and in a warm room. Allium cepa eye complaints are often accompanied with the nasal complaints or with the coryza. Whenever I say coryza, it is understood that there is lot of mucus secretion from the nasal cavity. The eye complaints which are seen in Allium cepa are, there will be bland watery discharge which is non-irritating. The eyes become very sensitive to light, and there is a burning, biting, smarting sensation in the eyes as from a smoke, and they have a feeling that they want to keep on rubbing their eyes. The gastric complaints seen in Allium cepa result from indigestion or overeating, especially cucumbers, salads, also from eating spoiled fish and from getting feet wet. The flatulent colic is often observed in babies in case of Allium cepa. Let's have a quick look into the remedy relationship of Allium cepa. The complementary remedies, that is, the remedies which will complement the action of Allium Cepa are phosphorus, pulsatilla, thuja. The action of Allium cepa is antidoted by arnica, especially in case of toothache, and chamomilla, especially in the abdominal complaints. The remedies that follow well after giving Allium cepa are belladonna, arsenic, pulsatilla, silicea, rustox, hipasal, spongia, calibrome, bryonia, sulfur. This is all about Allium cepa, my friends. Thank you. I hope you understand this remedy very well, and in case of any queries, do mail me or you can call me on the contact number given in the first slide. Thank you.